You may have seen in the news reports of hepatitis of unknown origin occurring in children. In the May 6, 2022 issue of CDC's Morbidity and Mortality Weekly Report, authors provide a description of 9 cases that occurred in Alabama. The purpose of this episode is to provide you with some of the information straight from the CDC in a somewhat simplified fashion. In the article, the authors describe 9 cases of hepatitis, and they all occur in children under the age of 6, with the average age of about 3 years. All cases occurred in Alabama between the 1st of October 2021 and February 2022. All 9 patients survived, but 2 required a liver transplant. The initial symptoms that the patients most commonly displayed were those of gastroenteritis, vomiting, diarrhea, and they had a fever. On initial examination, the patients had signs of hepatitis, most commonly yellowing of the whites of the eyes, enlargement of the liver, and jaundice. Laboratory results also supported the conclusion of hepatitis. Liver enzymes, which are elevated in case of liver disease, were quite high, and bilirubin, which gives the yellowing of the skin, was elevated in 8 of 9 cases. All 9 of the patients also showed evidence of infection with adenovirus. For those individuals for whom the adenovirus could be sequenced, the result turned out to be adenovirus 41. Adenovirus 41 is a fairly common infection in children, causing symptoms of gastroenteritis such as vomiting, fever, and diarrhea. 6 of the patients seemed to be infected with Epstein-Barr virus, and it appears that this was a reactivation of an earlier infection rather than an acute infection. The evidence for that is that IgM antibodies could not be detected against Epstein-Barr virus. IgM antibodies are a class of antibodies that are the first to be raised during an infection. The presence of IgM indicate an early stage of infection, and an absence of IgM in the presence of an infectious agent would indicate that that infection had been going on for some time. So it appears that the Epstein-Barr infections were a reactivation of a previous infection. All 9 patients were negative for the hepatitis A, B, and C viruses. None were infected with SARS-CoV-2, nor had a history of COVID-19. Liver biopsies were also taken in some of the patients, and there was no visual evidence that suggested a virus in the liver tissue. There were no inclusions, which are basically areas where the virus is being assembled, you could say. There was no evidence of infection or visualization using antibodies. Antibodies can be used to specifically bind to an infectious agent, and then those antibodies can be visualized. So this technique, immunohistochemistry, allows us to indirectly visualize virus in tissue. And the virus was not seen. Also, electron microscopy was done, and no virions, no viral particles were observed in the liver tissue either. So at this point, we have a disease in children that seems to be affecting the liver, causing hepatitis. There is an association or a correlation with adenovirus, but that certainly doesn't mean that's what's causing the problems with the liver. There is no evidence of the virus in the liver that we've noted so far. Additional cases have been observed in areas as wide as England and in Scotland. So this problem could be more widely spread than we might think. This is certainly something that epidemiologists are going to be looking at very closely, and we here at LTSL will be looking at it as well. And if you like these summaries, please let me know, as we'll certainly continue to provide them for you. Thank you very much.